Welcome back to the lecture. So this is the second part. I hope you enjoyed the Dr. Goldacre TED Talk. Let's hone in into our own profession, about speech pathology and your role in it. Now, you're going to treat thousands of clients throughout your career as a clinician, and you're probably not going to take photos of every one of them. But you do need to ensure that for each and every one of those individuals that you treat, you are going to be providing the best quality and the most relevant intervention. It is your responsibility as a speech pathologist. It's part of your ethical obligations, your professional obligations. So in this segment of the lecture, we're going to address 3 questions. What is evidence-based practice? Why engage in it? And what are the key skills that I need to engage or to do evidence-based practice? So what is it? Okay, now this is based on an earlier definition by Sackett, where he talked about the conscientious, explicit, and judicious use of current evidence in making decisions about the care of individual patients. These are the core concepts that are underlined here in a quote from Dolhan. 3 core components of evidence-based practice are research evidence, not on its own though. There's also the clinician or the clinical experience and expertise of the individual practitioner, but there's also patient values and preferences. You need to be careful to put these on equal footings. Okay, it is quite easy to think that if you find an article which shows that a particular intervention is effective, that you'll put that above everything else. But this is about gathering information from various credible sources and coming up with the best approach based on that. So evidence-based practice is not about just reading and evaluating research, although that's a skill that you do need to learn. So reading about research about a particular condition and then blindly applying the findings to your client. Okay, so you've got your clinical question, but your decision needs to be based on, yes, the best research evidence, this box here, but also your clinical expertise, which is developing. There's also the patient values and preferences. They may not want the approach that you feel is most appropriate or supported by the best level of evidence. They may have reasons for rejecting that. There are also clinical circumstances and settings. It may be that a home-based approach with particular interventions may be the best way to deliver a therapy based on the research. But in fact, the way your service delivers its therapies doesn't allow for that. So you have to take all of these things into account when delivering or making decisions about patient management or client therapies. In future classes, we're going to talk about concerns with systematic reviews and provide you with opportunities to learn how to determine the best research evidence. You'll also get some insight into how to integrate this evidence with other key factors or clinical expertise, patient values and preferences, and the clinical circumstances. So why evidence-based practice? Well, hopefully you do understand why by now, but let's just recap. It's part of your professional obligations. Speech pathology is a scientific and evidence-based profession, and speech pathologists have a responsibility to incorporate best available evidence from research and other sources into clinical practice. It's part of HCS5EPS. So it's included in the HCS5EPS range of practice principles. In all work contexts and decision making, the speech pathologist must consider the recommended evidence base for the speech pathology practice. HCS5EPS entry level, Unit 3, Planning Evidence-Based Speech Pathology Practices. As a clinician, you're going to be faced constantly with questions regarding the effectiveness and appropriateness of your assessment and intervention practices. In the end, there will be a key question you always need to know the answer to. What works? And just because you're told something or you overhear it from other clinicians doesn't really mean it works. EPS is designed to give you strategies that will stay with you into the future and ensure you provide the best possible care to your clients. You may be familiar with this diagram. This is the process that you engage in constantly throughout your day as a clinician. It's your decision-making processes, and as you can see, it's not linear. It moves, well, it is, but it moves backwards and forwards in terms of each part of the process of gathering information, assessing, diagnosing, providing counselling, intervening, and evaluating. And you do move between these. At first, it's difficult to move between them in that they're very conscious and very deliberate, but they start to become part of the way you function as a clinician. So, you need to know why you might be blowing bubbles in a child's face, and your client's mother will certainly want to know that. Or why you've got a laptop from 1985. Or why a parent might ask why her child can't understand speech in noisy conditions. You need to be able to explain why you are using a puppet to communicate with the child. It shouldn't just be a fad, it should be something that's based on the evidence. Or you should have some really good reason for doing it. You should be able to explain to a client's family why their dad's speech does sound less clear than it used to. So why evidence-based practice in speech pathology? Well, new evidence creates changes in patient care. And it's important that that new evidence is something that's translated into practice. And the person who translates that evidence into practice is you as the clinician. The amount of evidence is increasing, so you need to be able to sift through it in an efficient and effective way so that you know what that information is as it comes to hand and you can incorporate it into your practice. We absolutely need, but we do tend to fail to access new evidence because we're not hooked into the resources and the systems that will alert us to that new evidence. But the reality is that clinical performance does deteriorate with time and you have to renew your skills and renew your knowledge. There are major unanswered questions about the efficacy of treatment approaches in many areas of clinical practice, and we need to be aware of this and to know how to sift through what there is to figure out really, well, what is the best information that I can bring to this clinical situation, and how can I monitor whether or not it is effective for my client or patient, and how can I keep my pulse on the research that's developing so that when good evidence does come to change what I'm doing, I know about it. So, what skills do I need to engage in evidence-based practice? Hopefully you have some skills, but probably they're not sharpened to the degree that they need to be in order for you to be effective. Now, almost 10 years ago, this study was done, where Cipollone and Kennedy found out about the basis on which clinicians made their decisions. Unfortunately, they largely based it on their own experience. Now, for sure, we do use our experience because that's what expertise is all about. But it needs to be informed by other things. We rely largely on opinions of colleagues. They could be wrong too. Clinical practice guidelines are becoming more evident, and there is a subject that you'll be doing around this, and so you'll learn more. But they are based on current best evidence. Case studies, only 16% of people rely on that, and that's case studies can provide a certain level of evidence, but they don't provide rigor. Video or audio tapes, and only 17% or nearly 18% rely on research studies. So that's not a lot. Now, hopefully, because these types of evidence-based practice subjects within undergraduate curriculum have become more and more common, those numbers will have changed. So if this study was done again, hopefully we would see some differences so that people did look to the research more often. In fact, as we just said, in order to be an ethical speech pathologist, you really must. But remember, it's not just the evidence. The clinician has to relate the evidence to the condition of the individual patient, taking into account, for example, the risk factors or diseases that the patient may or the person may have, and then has to help the person reflect on the options they face, taking into account their values about benefits and harms. So it's part of what you bring to the discussion with your client. Gray talks about patient because it's in a doctor-patient context. But you have to bring this information to that context and have an open discussion, either with the person or with their family or support person. So patient choice is really important. And patients or clients demand valid and reliable information more and more. There is public knowledge about what evidence shows, but as you would have seen in the Goldacre TED Talk, sometimes people are misinformed. And as a clinician, we become what's known as knowledge brokers. That is, we should be able to look at that research base and explain to our clients exactly what it's telling us, exactly what the level of evidence is, and what messages they can take from that and apply to their own situations. Availability of information is still an issue in speech pathology. We are still building the evidence base, and some of you may go on to contribute to the evidence base as you become researchers, either in academia or in clinical settings. Clients need more information about available resources and how to access them. They will get information from wherever they can. They will go online, and some of what they learn will be accurate and some will be totally inaccurate. And as I said, you need to help them navigate through the information that's out there. And so that you need to be providing well-balanced information in different forms, and that can be a challenge. And it means that you need to be constantly on your toes and make sure that you know how to go and get the information that's needed. So one day you'll be an expert and you're well on the path. But at the moment, you're probably feeling somewhat like a novice, starting to learn how to do the processes, but not quite feeling that you've got the background, experience and skill set to feel confident. So where does expertise fit in? Differences do exist between novice and expert clinicians in decision making in terms of their risk-taking, problem-solving and strategic thinking. So what tends to happen as you read more and more in an area and you have more experience in an area, so my area, for example, is augmentative and alternative communication. Because I've been reading and working in this area for a long time, I've developed a certain level of expertise, which means I've been able to store information in a way that makes it easier for me to retrieve it. I can retrieve what's relevant and I can apply it. So I know the knowledge in a lot of areas relating to AAC, and I can look at the client in front of me and know which is probably going to be most relevant for them. The breadth of knowledge of information is wider for a novice because you haven't developed those areas of expertise and you're needing to move across a lot of areas. So where does expertise fit in? Clinical expertise supports Skillful application of research to practice. It helps you know when and where to apply the research, to know what to take on board and what you can disregard or put aside for the moment. It helps identifying for whom the research is relevant. Sometimes you have information or some good research about an effective intervention, but your client is a bit different. Okay? Maybe the research suggests that this form of teaching is really good for kids with autism, but you've got a child with Down syndrome. And so you're wondering, is this going to be applicable to this child? And then you also need to know when the research is no longer relevant for the client, when they've moved on and they need a different focus of their therapy and maybe a different approach. Evidence-based practice is not consensus-based. A technique that's frequently used and encouraged by peers when other clinicians may feel out of step, so they can see and begin using the technique. That is, trying to convince you that maybe you're in the wrong. Ideas passed down from one generation of clinician to the next are often considered to be facts, but they're not. People can engage in some fairly dated practices because they've always done it. They don't realise that those particular approaches are no longer supported by the evidence and in fact may be debunked. So let's revisit these areas. Think about which source of information you're going to rely on and think about it seriously. Okay? It is very easy once you leave university and go into your practice to not put the time that's required into really knowing the evidence base in the area that you're working in or that's relevant to a client. So remember, this is about your future. How are you going to future-proof yourself? There's rapid growth and obsolescence of treatments. Things that seemed appropriate today or a good idea have gone out because the research evidence has shown that really they're not as effective as we first thought. Without evidence-based practice, how will you keep yourself up to date? You can go to conferences and they're great. That's often researchers presenting cutting edge research so that you're the first to hear about it. But that's not enough. You can't get to conferences constantly. And even then, you have to be very good at critically appraising the information that's being presented to you. So embrace these following evidence-based practice enhancers: clinical guidelines, SpeechBite. Now, if you should have heard about this before, but if you haven't, just do a Google search for SpeechBite, and this is the speech pathology database where there are lots of reviews of research according to particular areas. There's professional development, such as going to workshops and conferences, but again, make sure that if a treatment is being presented, it is an evidence-based treatment. There are workshops around about interventions that are not evidence-based, and you need to be asking that question. So if you attend a workshop, the first question you should be asking is, what's the evidence? What level of evidence supports this type of intervention? And once you start reviewing or accessing databases, you can set up alerts. So for example, if you want to know if a particular AAC strategy is useful for an adult who's had a head injury, you can put in your search terms and do a search and then set it up as an ongoing publication alert. So if anything new is published in that area, it'll come into your email and you'll know about it. So I think you've got the message that we're saying evidence-based practice skills are essential clinically, and they're likely to outlast any other clinical skills in terms of their relevance and utility. They're a means by which you can access the current research, as opposed to us trying to tell you this is the current research. We're trying to skill you in being able to sort that out for yourself. The assessments that you're going to be engaging in this subject reflect the expectations of your professional body, Speech Pathology Australia, your employers, and most importantly, clients and their families. They're who you have ultimate responsibility to. It's a bit like a muscle. It requires lots of practice. Thinking is skilled work. It's not true that we're naturally endowed with the ability to think clearly and logically without learning how or without practicing. People with untrained minds, and that's not you, your mind's becoming more and more trained. So people with untrained minds should no more expect to think clearly and logically than people who have never learned and have never practiced can expect to find themselves good carpenters, golfer, bridge players, or pianists. And that was written in 1947 by psychologist Mander. So keep that in mind. If you find yourself in this subject feeling like it's not, you're not overly excited by it or you don't see the application, just remember it's a skill like any other skill you're learning in speech pathology, and it's a skill that you must have as a clinician. And the better you are at evidence-based practice, the more engaged and interesting you'll find it. There is harm in getting sucked in, okay? Recently, actually not so recently, a few years ago, a medico did some research on children who had had the measles, mumps and rubella vaccine. And it was very poorly done research. But on the basis of that, he claimed that there was a relationship between autism and this vaccination. And it went viral because he hit the media train. He went out there and he convinced families that vaccinations were a bad thing. And our vaccination rates plummeted, causing major public health risks. Now, his claims were based on no good evidence. And in fact, this medical practitioner, Dr. Andrew Wakefield, has since been debarred from the medical profession. And it was found out that he had a conflict of interest because he had a business relationship with the legal firm that was engaged in suing practitioners around the whole issue of vaccinations. So just be very careful. These sorts of claims, bad research can have bad results. So let's have a speech pathology example. You're going to go to another video, and this is of a program that was on television about a therapy relating to stuttering. And while you're watching this video, I want you to again be active. What are the things that scream out at you that this is probably not an evidence-based intervention? What are they doing and saying that are appealing to you, to your underlying beliefs or emotion? What are their strategies? And think about whether or not you're convinced about this intervention. And then I'll see you again for the third part of the lecture.